Today's conversation is about types of medical visits. And what I mean by this is Today's conversation is about medical visits and which type you should select when you're visiting your healthcare provider. Typically, this is only for primary care. So whether you're seeing a physician, a DO, a NP, a PA, whoever you may see, they probably have an online portal that they want you to use. And in that portal, you're going to have to pick what appointment is for you, essentially. So we have a couple different types. These are not all encompassing, but these are the ones I've seen most common. So we have our annual well visit, which in its name is your annual visit. This is typically required if you use insurance and they just want to check up on you, see how healthy you are. Now, when you're picking this appointment, this is strictly just for that one time a year visit to do kind of a systematic check that is required by insurance. This is not a time to present a problem or something that has been going on for a while that you haven't been seen for. This is literally just to cover the basis, and there are certain things your provider has to check off. So that's why a lot of times if you present a problem in that annual visit, it's going to feel dismissive because they're going to say, hey, can you please just schedule another type of appointment? Or they're not fully invested in that problem at that moment. And that's because they now have to figure out in their notes how they're going to get this appointment submitted to insurance. Now, granted, I know that feels kind of like a struggle between the medical system, the insurance system, and the patient themselves, because it really is. But your provider is going to offer different types of appointments, and that is important for you to know. So we've covered our annual well visit. Now we're moving into our problem visit. This is exactly what the name is implied again. It is for a problem, whether it is an acute problem or a chronic problem. This is what you're going to select. Now, this is different than a sick visit because a sick visit means you're telling them that you actively feel sick. Like you have a cold, you have the flu, something is going on, you feel sick. That is our sick visit. A problem visit is there's something going on. I don't know quite what it is, but I want to tell you and I want to get your thoughts on it because it is a problem for me. Now, in those two appointments, that is telling the provider, hey, it is time to put on our critical thinking hat and figure out what is going on with this patient. Now, the next photo I do will discuss how we talk in appointments, which I think will actually clarify some things, at least on a certain end of communication from patient to provider, because it is a relationship. So we need to focus on having healthy communication, but I'm digressing a little bit. So now we have a follow-up visit. Our follow-up visit is for things that we have already discussed with them. So we had a problem, we went in to be seen, and now we want to follow up on that problem. Either it was scheduled by you or it's scheduled by the provider themselves, but it's to go over what has been happening. Has anything changed? Let's reassess. Then we have a pre-op visit. This is typically used for if you're a patient and you need to go have a procedure or a surgery done, and the surgeon or the doctor doing that procedure needs to know that everything in your body is good to go for this procedure. So that's typically only for a pre-op. So that is a pre-op. I'm blinking on the word op right now, so please excuse me. And then other types of providers, sometimes these are two that I have seen for appointments. One is diabetes, and again, it's in the name. That is for if you have diabetes, you're following up on your diabetes, specifically only related to that. So if you don't have diabetes, don't select that option. Now, gynecology, some providers do this. Some primary care can offer gynecological exams. And so if it's that time for you and you want to get it done by your primary care instead of an OB, you can have the possibility to do that at this appointment. Or again, just be sure that when you're picking your appointments that you are actually paying attention to the appointment type you're selecting, because depending on your selection depends on, one, how your provider is going to come in. Are they ready to critically think about a particular problem you're going to present them? Or also it's going to dictate how much time is allotted for you So I've seen follow-ups be as short as 15 minutes, where I've seen an actual problem visit get scheduled for 30. And that's good because that's telling the provider how much time they need for this person. Now, I get 15 minutes is not necessarily adequate to discuss a follow-up sometimes, but each provider is a little different just depending on their practice. So again, keep in mind, this will actually set you up for a lot of success when you're visiting your provider because it's telling them which type of situation they're going to be walking into, and it helps you get more time that you need at the right visit. So if you have any questions about these types of visits, other types of visits you've seen, please ask them. I'm happy to help in any way that I can. And if I don't exactly know, I can always reach out to somebody who does know. Best of luck.